My name is Eduardo Caronna. I'm a neurologist at the headache unit at Vall Hospital in Barcelona, Spain. I'm going to talk to you about headache associated with COVID-19, the disease caused by the SARS coronavirus 2. According to the World Health Organization, headache is listed in the category of less common symptoms of COVID-19. In general, headache attributed to a systemic viral infection is a diagnosis reported by the International Classification of Headache Disorders, but it is not properly defined. In regards to the epidemiological data, retrospective studies on neurological symptoms of COVID-19 have reported that the prevalence of headache in COVID-19 patients is around 14%. However, studies specifically focusing on headache have shown higher prevalence, reaching 59%. During the COVID-19 peak of the pandemic, due to the need of doctors at the ER, many neurologists like me started to attend COVID-19 patients at the ER as general clinicians. This was an opportunity to better observe the presence of neurological symptoms such as headache associated with COVID-19 that otherwise were not analyzed in detail. So, in our hospital, we conducted a prospective study, which has been accepted in Cefalea, on COVID-19 patients attended at the ER. We observed that of the 130 patients recruited, headache was extremely common in 74.6% of our sample, and other neurological symptoms like anosmia and ageusia were more common than reported in retrospective studies. We compared patients with and without headache, observing that patients without headache were older and there were more men. Patients with headache were more women and had more anosmia and ageusia. But at the ER, we also observed patients with different headache characteristics. Specifically, in our cohort, 25% had severe headache with migraine-like symptoms, migraine-like features such as throbbing quality, nausea and vomiting, which was not associated with more proportions of previous migraine history compared to patients with mild-moderate pain. And patients with severe headache had also more constant and difficult to treat pain and more frequently presented headache before any other COVID symptom. Another recent study conducted in Spain on headache characteristics in COVID-19 patients had detected different phenotypes on the basis of headache features and the presence of personal history of primary headaches. And it showed that patients with a history of primary headache are more likely to have headache associated with COVID-19 that resembles their usual one. In our prospective study, we followed up patients during 6 weeks. We observed that 37.8% had ongoing headache, and interestingly, 50% of them had no previous headache history. So those patients with persisting headache had a higher proportion of headache starting as the first symptom compared with patients that were not suffering from headache anymore. Concerning COVID-19 evolution, presence of headache was predictive of 1 week shorter COVID-19 disease duration. A better prognosis of COVID-19 in patients with headache is further supported by a recent retrospective study where hospitalized patients with headache had a lower risk of mortality. Concerning pathophysiology, considering that headache attributed to COVID-19 could mimic migraine, even in individuals without a personal history of migraine, we could hypothesize that there is a meningeal peripheral sensitization and therefore an activation of the trigeminal vascular system underlying this headache type. Amongst possible mechanisms that could lead to the activation of the trigeminal vascular system, it is worth remembering the association between headache and anosmia, as we mentioned before, since it may support the hypothesis of a neurotropic mechanism, the virus being able to invade peripheral nerve terminals and enter the central nervous system through transsynaptic pathways. So, inside the nasal cavity, there may be a peripheral activation of the trigeminal vascular system mediated by the pathogen itself, acting not only on the specialized olfactory epithelium, but also on trigeminal branches present at this level or through olfactory trigeminal interactions. Another pathway could be explained by the fact that SARS coronavirus 2 can reach the meninges through bloodstream dissemination. So it creates at this level inflammatory reactions through the interaction between the virus and its receptor, the ACE2. But we also all know that COVID-19 may trigger a hyperinflammatory state in some patients known as cytokine storm. In this context, systemic inflammation could also engender neuroinflammation, being responsible for headache. Especially interleukin-6 has been demonstrated to have a prominent role in both COVID-19 cytokine storm and in migraine. Interestingly, in our study, we observed lower levels of interleukin-6 at the EER in the headache group. And during COVID-19 evolution, levels of interleukin-6 seem to be more stable in patients with headache compared to the ones without it. So it seems that systemic inflammation is kept more under control in patients with headache. This is consistent with the finding of another recent study observing lower C-reactive protein levels in COVID-19 patients with headache at the ER. But other molecules, of course, such as CGRP, may be involved in the relationship between systemic inflammation and neuroinflammation. Recently, there is growing evidence of a regulation of pulmonary inflammatory responses responsible for the severe forms of COVID-19, mediated by the vagus nerve, which, through the activation of TRPV1 channel, could promote the release of CGRP. However, the specific mechanism should be better clarified by future studies. So, headache as a symptom of COVID-19 is a result of a complex mechanism involving personal genetic predisposition, the trigeminal vascular system, and in general brain characteristics, and of course the SARS coronavirus 2, its neuroinvasive potential and its ability to produce inflammation. So we have to take this unique opportunity to study headache during COVID-19 because it will help us better understand not only COVID-19 but also headache in general. Thank you.